Hi, welcome in. Alrighty, well, welcome in. My name is Kyla. I'm one of the master estheticians here, and today I'm going to be showing you a little bit of laser hair removal. So our patient here, she's going to be doing laser hair removal under her arms. This treatment helps to reduce hair follicles over the course of many treatments. So this is her first treatment. Typically, we'll kind of go through a full consultation process where we're going to discuss her goals, medications, health history, all of the factors that may make her a good candidate for this treatment or maybe not a candidate for this treatment. She's a great candidate for this in the sense that she just shaves the underarm area, which is what we want. She also has dark hair, which makes her a good candidate. So we're going to get started. When you're ready, I'll have you lift your arms up and we're going to get you all prepped. The first step of this treatment is to prep the area. Especially in the underarms, it's very important that we ensure that the area is clean. This area can have, soap residue from showering, deodorant, so we want to make sure we cleanse all of that off. I'm also going to get our laser going here, so it is all ready to go. So we will start off with a bit of alcohol. Like I mentioned, she has already shaved, so our patients come in with the area already shaved so that it is ready for treatment. So I'm going to cleanse the underarm area here. And I will do the same on this side as well. The treatment itself only takes a few minutes, which is nice. It's also very painless. So our patients only experience a small amount of heat and a little bit of a prickling sensation, and then there's no downtime. So she can go back to her normal activities immediately after. You can even apply deodorant right after, so she can go right back to her normal day-to-day activities. There's not really a lot of irritation or things to be concerned about in between treatments. So next we apply a little bit of ultrasound gel. This helps to keep the skin nice and cool. Like I said, the laser can be a little bit warm, so this process helps to keep her skin cool while the laser is firing. The actual tip of the laser is very, very cold. So this gel acts as like sort of a cold blanket to hold the cold from the laser onto the skin. So we'll apply that here. Perfect. And then next, I'll give the patient some glasses. There you are. Protect the eyes, safety first. And then I will wear the glasses as well. Next, I'm going to apply the appropriate laser settings. Each patient is a little bit different. We're choosing settings based on the area that we're doing, the patient's hair type and their skin type. So I'm going to go ahead and select the settings that I would like for this treatment. Get everything ready to go here. And then I will grab my laser handpiece. Do you have any questions before we start? No. Okay, perfect. All right, and with this laser, we're using a multi-pass technology, which basically means I'm going to be switching between cooling the skin and treating the skin. So I'll be just passing the laser in the area and you won't hear anything. That's just cooling. Once you hear that the laser is beeping, that's when I'm treating the skin. We're trying to get to a certain level of laser energy to kill the hair follicles. So if it gets too warm, let me know and I'll just cool, but I'll kind of be going back and forth.
Okay.
So we start off by just cooling the skin. All right, are you ready? Mm-hmm. All right, so here we go. Just applying the laser energy in a few passes here, back and forth. Still feeling okay?
Yeah, no, you don't feel anything.
Perfect. So it's nice and painless for our patients. This is sort of the newest generation of laser hair removal devices. This technology is less painful. It also has less risk of burning because we're applying the area or the energy to the area in a lower amount, just going over the area multiple times. This also allows for us to target specific areas that are a little bit more stubborn. So now I'll just cool the skin. And again, treating the hairs. Sometimes patients will feel little bits of heat, little prickles here and there, but it shouldn't be uncomfortable. There's no need to do any sort of numbing beforehand. It's fairly painless. Perfect. So we're done with one side. I'm gonna get that area cleaned off and then we'll move over to the other side. Is it easier than you were expecting?
Way easier.
Good.
I literally don't feel anything.
Wonderful. All right, perfect. Wonderful. You can relax this arm down. And then I'm going to come over to the other side here. Perfect. And again, starting off cooling the skin and then start treating. So the way that laser hair removal works is the laser is targeting the pigment that's in the hair, and then it's actually using the hair as a pathway to travel down to the base of the follicle and destroy the hair bulb, which is the part that grows the hair. This treatment works the best on the hairs that are in the active growth phase of the growth cycle, which means that this treatment is not a one and done. So she's gonna have to come back in for typically around 4 to 6 treatments, and we space them out every 4 to 6 weeks. So she'll be coming in about once a month. She'll shave before each treatment. And then typically we recommend, sticking with that 4 to 6 week range for the best results. She'll see about 10 to 30% reduction with each treatment. And what you're gonna notice after this treatment is when you leave here, the area is gonna look exactly the same. But in about 2 to 3 weeks, when you go to shave, you'll notice that there's less hairs. The hairs are actually gonna start to fall out over the course of the next couple of weeks. But it happens so gradually that oftentimes patients don't notice until they go to shave the area again. And then you will see there's less hair. Still feeling okay?
Yeah.
Perfect. We're almost done. Wonderful. All right, and all finished. Like I said, there isn't a lot of downtime with this treatment. There's nothing really to be concerned about as far as, redness or irritation or pain. It's a very, very quick, easy, painless procedure. With laser hair removal, it used to be something that was a little bit more painful. Patients were afraid. They would use numbing cream, but the way the new lasers work, and specifically the lasers that we have here in our office, we're delivering a lower level of energy over the course of multiple passes to get to that same level as the traditional lasers. So just as effective, but much more comfortable, and also much less risk of the patient burning their skin. You can go ahead and relax this arm down. And that is it. That is one laser hair removal treatment. Thank you so much for joining me today.